Hello friends, let us now learn some important things about the imposters. Imposters are some things which make us get confused to be a collapse. These imposters will mimic the appearances or the changes of collapse. So as a result, we might misdiagnose the patient has collapsed while the patient in reality has something else. So always if you have a doubt of whether it is collapse or not, it is always advisable to take a lateral chest x-ray. Now when you take a lateral chest x-ray, we can confirm that whether there is any collapse or not. Then some of the appearances, some of the things which can be mistaken for lobar collapse based on the lobe wise is given in this table. This is taken from chest x-ray survival guide, the total table. Clearly we have taken it from that. So whenever there is right upper lobe collapse, right upper lobe collapse, right upper lobe collapse might mimic or it might, so some of the diseases, so if we have to say some of the diseases like azygous fissure or unfolded neck vessels in elderly, these might mimic the right upper lobe collapse. Similarly, depressed sternum or some of the normal fat which is present in the heart border might mimic a middle lobe collapse. If there is any epicardial fat pad or if there is any accessory fissure, these can also mimic right lower lobe. If there is any unfolded aorta or hiatus hernia, might mimic left lower lobe collapse. Whereas left upper lobe is the only unique presentation with no impersonators. So if you see in this picture, we have azygous fissure. This azygous fissure might be sometimes confused with right upper lobe collapse. So it is better to be careful while we are diagnosing a patient with right upper lobe collapse. Then here actually the right heart border is not clearly seen. The right heart border is blurred. And you can also see some consolidation which is seen here. Whereas in the lateral chest x-ray, you will see that it is due to depressed sternum which is causing this appearance in the frontal chest x-ray. So there is no collapse of the middle lobe. It is just because of the sternum, it is seen like this. So this is one thing which you should remember. Next, here this is an unfolding of descending aorta. This unfolded descending aorta might sometimes be confused with left lower lobe collapse or sometimes an epicardial fat which is present. This epicardial fat might also be misdiagnosed as right lower lobe collapse. So always when you have a doubt, it is better to think about the bronchovascular markings. If it is collapse, you will not see the bronchovascular markings. Except in aorta also you won't see bronchovascular markings clearly though. In descending aorta unfolding also bronchovascular markings are not seen clearly. But if it is a fat, over the fat you can see the bronchovascular markings clearly. So that can help us to distinguish and to if we have any doubt about the imposters or if we have any doubt whether it is really collapse or not, it is better to obtain a lateral chest x-ray and then decide to give the diagnosis as collapse or not. Thank you.